really pleased to be here and to have the opportunity to tell our story. It's not something that I do comfortably and naturally. I'm not usually up there talking about what we've done, but part of telling the story has been what we've learned as we've used the team journey and working with teams. Being able to talk about what's worked and what hasn't has made a huge difference to the impact that we've been able to have in the work we do. So when I was asked to come and talk about what we were doing, it's not about how amazing we've done it, it's just about what we've learned, and because we know that telling that story makes a big difference. So I hope that you'll find some of this of interest and of value to you, and I think it'll just give you a sense of some of the real experience of working through quite formal model at times in terms of team effectiveness. So that's what I want to do. I'm going to tell you a little bit about the context that we were working in, some of the challenges and what's helped us with it. So this is our story. You've had mention before of what's been happening in NHS Greater Glasgow and Clyde in terms of the senior team. We've talked about the leadership programme. The part of world that I'm in is health and social care partnerships. So it's into that integrated world. Did any of you have any experience of that side of things? Yeah. Good. So you know. What we found was that as we set up the Glasgow City Health and Social Care Partnership, which is one of 6 across NHS Greater Glasgow and Clyde, it's a big organisation, 6 local authorities we have to communicate with, Glasgow City being the biggest one. The team of people who were there to support the development of the partnership all had an NHS background in terms of organisational development. So we sat there with what we knew about how the world worked, about what you could do with teams, what you could do with leaders. We had our map and we knew what we were doing. And then we ended up working with the partnership. Now this lovely picture, I hope you like it, is from this year's summer holiday. This is the road up the Grossglockner Pass. Is anybody familiar with it? Have you been up it? Did you open your eyes at all?
Yes.
This is a road that was built opposite the highest mountain in Austria, and it's one of these ones with just loads of hairpin bends and steep slopes, and so it's a very unknown landscape. It was a terrifying landscape for me because I don't like heights. We found ourselves in a landscape like this. We didn't know the language, we didn't know the culture, we didn't know the expectations, but we knew it was different. And we were trying to bring in our map and see what we could do with it, and very quickly realised that wasn't going to be a good fit because we had people from different backgrounds, different experiences, and a different sense of what was important, and lots of change going on at the same time. So we had some models that we liked to work with. Do people love a model? If we can tell you, if you'll just do this, life will be perfect, all your problems will be solved. And in the past, we had worked a lot with the material that Michael West and others had developed. So we'd used team questionnaires before, and we'd had a kind of varied success with it. What really worked, particularly with clinical teams, was you could provide evidence about the increased life expectancy that patients could live, and that you could show people that if you could put certain things in place, you would have good results, not just for your environment within the team, but the work you were trying to do. So we were committed to that type of approach. So we were introduced to the team journey, and we got accredited. This is our motley crew. It's changed a bit over the years, but what's most important about this picture is not the people holding the certificate, but actually the person at the end, who was a really supportive senior leader and manager who wanted us to do well. And that's what started to make a difference within the partnership that we were in. So that context of not quite knowing what the rules were, how we were going to apply it, what we were going to do, was helped by having senior people who were saying, well, we have to take a different approach here. We have to think about what we want to do. But because we had our toolkit again and we were ready to go off, we just started to take a bit of a random approach. So as you'll know, working in ODE, quite often we'll get a request, can you help me with this team? They just won't do it. Or I've been put in and I'm the leader and they don't understand. Or they won't accept my role because I've already been part of the team. Or they won't accept me because I'm from a different background. So all these kind of different things were happening, teams weren't getting on in little tiny pockets. And we went in with our team journey. And eventually what we started to hear was, have to go back to Old World. We're going to be Astoned. And don't Aston us. Because we're special and we're different. And because there's just some particular things going on with our team that won't fit that model. So they thought they received it as formulaic at times, and they received it as something that just wouldn't apply to them. While at the same time they were also saying, and this was the most difficult bit, isn't that your job? You're supposed to come in and help us do this. You're supposed to fix it for us. And actually, to be completely honest, in the bottom of our hearts, that's probably what we thought we should do. Because how would you do your job if it wasn't you doing the team development session? So there was quite a challenge there, not just within the organisation, but with ourselves and understanding what the difference was. One of the big differences was there were too many teams. There was too many teams, and this is a big version of our team. It's reduced since then, and as most of you will know, resources are coming back all the time. So having a way of working with as many senior people and supervisors and team leaders as we could meant that we couldn't deliver all the time, and we had to start working with people to help them do what they really should be doing and working with their own management style and approach. But that randomness continued for some time, and the resistance. But what happens, well, people in the NHS don't know this, what happens when things are really hard, when there's no money, when you don't know what to do, and you're at the end of the road? Restructure. Within the Health and Social Care Partnership, we decided to have a restructure, even though we just formed as a partnership. There were too many managers. There was a lot of issues. There was a lot of things to deal with. But what came out of that restructure, along with some people who were supportive of taking an OD approach, was that some sort of key issues. They said it's got to be about relationships. It's got to be about relationships and collaborative leadership. It's got to be about whole system working. So we have to really understand how the system works and how we can work together. So we developed a model within the partnership that was very service-based. So we went from a geographical approach, if you like, to children's services, all of adult services, which is massive, and older people services. So there was a start to think about, if I, as a leader, have to work across the system, I am going to have to lead people who are from different backgrounds, both clinical and social work. Those different professions will be coming together. So I need to think about how I work with them, because I don't have that necessary credibility of knowing the job all the time. Commitment to teams came quite strongly from the beginning, which is great because loads of senior people want us to work in teams, but like the rest of us don't have a clue what that actually means. To be in a team feels good, especially when it's winning, but the amount of things that you have to give up, or in terms of compromise to be in a team, is a much more challenging place. And when we got to the bits about what is the purpose of this team, a lot of people were faced with questions around, well, we're not a team, we're a group, so we don't need to think about this. What are we actually doing? And it did raise some quite challenging issues. But what we did have as an OT team was not loads of time to do the work, but enough time and space to think about what we wanted to do. So as we reflected on the bits where we were having success and the bits where we were having our challenges, we realised that actually what we needed to do was work differently as a team. So we developed we did our own journey, our own set of objectives, and realised that actually it's the story that we tell about this that's going to have the most impact. So we need to have a framework that can show people this is what can be done, and this is how we'll do it, and this is the difference it will make. So we started to think about how we would shape that framework. I've just put this up as a slide to show you that we had a framework. The content of it's not important, so I do know it's a bad slide in terms of giving out information, but it's just to show you it's there. But we needed to have a way of just telling the good stories, telling about where it had gone well. And so in one particular service area where they needed to look at the whole structure and governance within children's services, we were able to say, give us a certain amount of time and we'll work with you and we'll coach you and we'll develop you to work with your own teams. And we'll do that across the whole of the system. And that started about a year ago. And in that year, we've had a number of successes in terms of the the senior team identifying how they want to work together, and then them working with their own teams. And what we discovered was some teams would actually, if you thought about how they operated within the system, they would all have similar objectives. So you could actually bring them all together for some of this work. What really helped was there's a piece you do in the team journey where you ask people to identify what's their shared agenda and what's their shared objectives. HR people in the room, conversations you've had with people about setting individual objectives. It's not a great skill out there, how to write an objective, would you agree? So, confession, we did write a lot of their objectives for them in that kind of encouraging, supportive way. What about if you said it this way? And the more we did that, the more comfortable we got with what we were saying, so the more we were able to write them. And as people heard that, they would become more confident themselves and start to come up with their own objectives too. So that was another part of that story of success, because then people would start to tell each other what they had been doing and what had been happening. So I think that enthusiasm for what we could do meant that we could get through. What you've got here is we've called it stage 1 structures and processes, and stage 2 bits is the sustainability. That sustainability model has been something that's really helped us work in a more focused way, because we've been able to say, have your first couple of sessions, and then we'll come back in 3 months, and then we'll come back in 3 months. So there's a continued repetitive approach, but it doesn't feel like a big elephant that people have to bite, that they can actually see it in chunks. And what we've managed to do with getting through some of the formulaic stuff about if you are an effective team, you'll know who you are, you'll know what you're doing, you'll know how you work together. Then we get to some of the sexy woody stuff, so where people want to talk about their relationships and how they got on with each other, which had been at the heart of a lot of the work that we've been doing before. People want to find out what's my personality, how interesting am I to everybody else. But actually, what you were doing was spending days with people, keep them out of the way of the buses, not necessarily making a difference to the work that we're doing. So you're left with this so what question. What we've been able to do is bring that in when it's been helpful, but in it at the right time. So our model is a behavioural profile, but people have different models and different ways of working. And again, that's why you can't read the detail of it, because that's not the bit that's important. It's more about the phasing and the timing of it. And that's what's worked for us, is being able to say, we'll take the journey and we'll put it in our language, which is a new language now for both parts of the different organisations, and we'll support you. But as you become more confident, we really need you to hold this and work with it yourselves. So we've continued to collect people's stories. So it started in the newsletter, and we put a bit in the magazine, and then it went on the website, and we managed to get a bit into this year's annual performance report for the HSCP about our team effectiveness framework, and some quotes about what we've done. And of course, we were also able to link it to our staff engagement surveys. The children's services have really worked with this wholeheartedly and whole system, and that's our biggest story. But we were able to bring into children's services that experience from other areas as well, about bits that had worked and bits that hadn't worked. And I think it's the fact that we've been able to be quite honest about it's not the answer to everything, but it gives you a shape to work with, where we can do the other stuff as well. So this is my favourite one. This came in the email last week, so this is hot off the press. And it was from a manager who'd worked in an area where they'd been particularly resistant, but she had decided that she would continue working with the team journey even if her colleagues weren't. So she said, I wanted to know the session went very well, and she's just about to send her questionnaires to get that bit about how people are feeling. Well, discussion was positive, but the key bit is the change in the scores in the iMatter, that's the staff engagement survey from last year. So she's increased that by 5% in terms of engagement. And the other bit, our feedback on the organisational part was also more positive, and in that questionnaire people can talk very positively about the team, but they tend not to talk well about the organisation because they don't see how they connect to it. And I think just to have that feedback from one of our managers was, I don't know, I think I'm going to stick on the wall somewhere. I'm really pleased with it. So I think that's the main bits of the journey that I wanted to share with you. It's been quite challenging. I've had loads of support, and I think the fact in EOD there's been a real positivity about what you do, so even when it's a disaster they can put quite a positive slant on it, which is really helpful, but also helps to keep you going. But more than anything, it's just being able to tell a story about this is what they did there and bits of it were useful, so you can use that too. I think that's the kind of the key part of what I wanted to share with you.
Lovely, Isla, thank you very much.